It's nice to meet you, man.
It's nice to meet you too. It's really an honor, I have to say.
Well, the honor is mine. This is a kind of an unusual chat because I,
Thank you.
I'm I'm a fan of your work, and
Thank you.
I saw you on Instagram, and your Instagram is kind of like artwork. Even when you recommend certain supplements, you don't just put the name, you put the picture of the bottle. It's kind of like art. Do you do that on PowerPoint or Keynote or?
I just do it. There's an app called, I think it's called Canva on the iPhone, and I just do it on the phone with my fingers. I grab the Google image and I save it, and then I crop it down and I put it there. It's all just on my phone with my fingers.
Amazing, amazing, and then your website also such a piece of work, you know, and the name of your practice I love the is it Peaceful Mountain?
Yeah, so my middle name is O'Shaughnessy. That's my mom's last name, and that means peaceful. And my last name Monahan means mountain. So it's actually my name, Peaceful Mountain, if you translate it.
Oh, that's great. That's great. And
Yeah.
so usually when you talk to somebody and you post it on internet or on social media, you give a whole presentation of who they are. But the only thing that I know about you is that I agree with everything that you post, right? It's kind of also my philosophy.
Yeah.
Um, that you do Chinese medicine, you do acupuncture, cupping, and you do nutrition as well.
Yeah.
Um, are you a Chinese medicine doctor?
Yes, exactly.
Uh-huh. So you studied Chinese medicine.
Correct. Master's and doctoral in Chinese medicine. Where? Emperor's College in Santa Monica.
Oh, really?
Yeah.
So you're a LA boy.
I am. Where are you? Are you in LA?
I'm in LA, but I was born in Uruguay, and I've been, before I came here, I've been all over the world.
Yeah. Yeah. Amazing.
Yeah,
Where are you in LA?
in Venice.
Oh, cool. Yeah. So, Santa Monica, 18th and Wilshire. That's where the school is.
Cool, excellent. So this time of pandemia, and so many people are so scared. I look around on Instagram, and everybody's talking about what to eat and what supplements to take, and the points of view mostly heard are the functional medicine point of view, and maybe the Ayurvedic point of view, but not so much the Chinese medicine point of view. And I'm really curious what what you make with all of this, and what you tell your patients.
Yeah, absolutely. So, Chinese medicine is built for this exact type of scenario we're in. Uh, Throughout the last 2,000 years, Chinese medicine has dealt with 320 different large scale epidemics just like this, and many much worse than this. So, we have a lot of herbs and formulas and approaches that have been, tested over time. So, all that trial and error, we've kind of figured out what works and what doesn't work. And of course, we're keeping all the things that work and leaving all the things that don't work. And that's happened over thousands of years. So there's really been, lots of preparation for this. The go-to in Eastern medicine, Chinese medicine, I should say, is really going to be herbs and formulas. So I've been working with a lot of my patients in terms of herbal medicine. So preparing formulas that are preventative for people who are healthy and want to stay that way, and preparing formulas for people who are sick or very sick. And all of those are going to be different. Ideally, you're looking at the individual. We're treating the patient, not the disease. And so we look at their whole presentation, and we do a differential diagnosis. And then we build a custom formula based on their specific needs. That's generally what I'm doing. There are two formulas that are kind of being used a lot. One is a preventative formula called Yu Ping Feng San, which translates to jade windscreen powder. That's a classic patent formula that's been used forever. It's got three main herbs. It's got huangxi, which is, most people are familiar with it as astragalus root. It's got fang fang, which is sila root, and then it has baizu, which is white atractyloids root. And those three herbs together create they boost your defensive wei qi. So that's an energy that surrounds us, that protects us from external pathogen invasion. Because of this specific virus, we're adding a few additional herbs that are antiviral. So there's going to be honeysuckle, jinyanhua, Dryopteris root, which is Myanmar, Guanzong, chenpi, tangerine peel, peilon, eupatorium, and those are really going to help for this specific instance. And then there's another formula.
So hold on. So these formulas that you're talking about are in general for the immune system, or are they specifically for viruses?
The main base of the formula is going to be very immune boosting. And then we're adding in antiviral herbs because this is a virus, right? So the base formula is more of a building up the immune system that we use for people who have maybe seasonal allergies, that have difficulty with allergies, or people who get sick really frequently and easily. So we're building up that immune system with the base formula. But since COVID is a virus and people want to be protected against that, in case it does enter their field, we're putting those additional herbs in that are specifically antiviral. So it's a combination.
And when in Chinese medicine you speak about the immune system, in Western medicine, in functional medicine, the immune system, when doctors talk about it, it's the bone marrow with the white blood cells, and then the gut where they go and deposit themselves, and the Peyer's patches in the gut, and then the lymphatic system. So it's a whole anatomical and then physiological, molecular thing, right? But in Ayurvedic medicine, there's a whole other explanation of what the immune system is, and I want to see and compare notes with Chinese medicine.
Yeah. So how does Chinese medicine look at immunity and all of that? We look at it, we call it your defensive qi. So your defensive energy, it's your wei qi, W-E-I. And that's really what we're going to be working on anytime we're trying to work on the immune system. And those correlate, that defensive energy stems from your lung energy. Your lung energy in 5-element theory is a metal energy. And that metal energy is supported by earth energy. So your earth energy is your spleen and your stomach, and that's your digestion. So the beautiful thing about Eastern medicine and functional medicine is that, first of all, they both want to get to the root, and second of all, they both strongly believe in gut health and digestive health being the center of everything. So in Eastern medicine, if we want to boost the defensive energy, aka the immune system, you ultimately need to nourish your digestive energy, because that's what supports the lung energy, and that lung energy is your defensive energy. So a lot of what we're going to do in Eastern medicine, when we're in Chinese medicine, when we are working on the immunity of someone, we're certainly working on the lungs, but then behind that, we're working on the digestive energy. And that translates to functional medicine and even just Western medicine in general. The vast majority of our immunity is housed at, like 70-80% of our immune cells are housed in our gut. So if you're working on immunity, you're really working on somebody's gut health ultimately. And that parallels to Eastern Chinese medicine. It's called the Earth School, and it's been around for thousands of years.
And I'm just curious, do you know if Ayurvedic medicine, when they talk about the 5 elements, they are the same, they correlate functionally with the 5 elements in Chinese medicine?
I don't have a background in Ayurvedic medicine. I've read books and I love it, and I think there's so many parallels, and I love everything about it. I think it's beautiful and wonderful, but I wouldn't be able to speak to it as well as I would Chinese medicine. So I don't know if they do parallel.
Zach, I'm curious now to see if there's something similar to the dosha system in Ayurvedic medicine, right? Where one element dominates and tends to go out of balance?
Yeah, so that I would say yes. You know, in the little I do know about Ayurvedic medicine and what I've read, there's a lot of similarities, and we do look at individual constitutions, and we do kind of do a differential diagnosis for that individual patient, and we paint a portrait, of what they are. And a very common example in the West is going to be it's a wood-earth imbalance. So the wood energy is a liver energy. It correlates to a lot of like emotional stress. And since we have a lot of that in the Western culture, that wood energy can overact on the earth energy. So emotional stress is going to disrupt digestion. And a lot of people have digestive issues, right? And so what's at the root of that? Oftentimes it is an emotional imbalance. So we're working always to balance that wood energy and earth energy with a lot of people. But that's just one example. I mean, there are dozens and dozens of different presentations.
Yeah. And have you studied functional medicine?
Yes.
Have you done the AFMCP and all and some other courses there?
I have not. I've done Chris Kresser's ADAPT program, practitioner training program, and then also a lot of seminars around. And I've just been studying on my own for probably, 5 to 7 years. But your book was actually, I have it right here. I got this in 2011,
Oh, cool.
and this was very foundational in my path to health and wellness. It was really like a foundational blueprint, and it's such a great contribution to my life and so many other people's lives. So I've been, I started as a patient of functional medicine in around 2007, 2008, and that's really where my learning began.
Oh, what happened? Tell me.
What happened? I started having a couple issues. Actually, it's very appropriate for what we're going through right now. I started having lung issues and digestive issues. And in Eastern medicine, those are tied together, like I was just talking about, the spleen energy, which is digestive, and the lung energy. So my lung issues were really stemming from my digestive issues. So both Eastern and functional medicine, I started working with an acupuncturist and also a doctor of functional medicine at the same time. And between the two, they just transformed my whole life. I made some very simple changes. I cut out gluten, soy, dairy, things like that. 2007, nobody even knew what gluten was. I didn't know what it was.
How old were you in 2007?
How old was I?
Yeah.
27.
Oh, okay.
Yeah.
And all of this was in Los Angeles.
That was in San Francisco. Yeah.
Uh-huh.
I used to live in San Francisco.
Cool.
Yeah.
So you got better, and then you said, "This is my passion."
Exactly. As I started to learn more about Eastern medicine and functional medicine, I was like, first of all, I started feeling better than I'd felt in my entire life. And I just started transforming into a different version of myself. And I was like, this is powerful. This is really powerful. And I just wanted to know how it worked, because it seemed like magic. I didn't know what was happening with the needles and the herbs and, the small dietary changes and supplements. And like, I was fascinated at the ability to transform. And I started reading about it, and then I started taking classes open to the public. And then I just decided to make a huge shift in my life, and I decided to go back to school. And that's kind of my quick story.
It just happens that the wounded healer, right, which you are an example of, are usually the people that have the most passion and that actually affect the most change, And I shouldn't say the most and not generalize like that, because I know incredible scientists and doctors that never had a problem, and the interest was just born in them out of inspiration or whatever. But it is very frequent that people that had problems that get solved and healed in a certain way, when they get interested and go deep. And I can tell now why you do what you do, and you put the art and the love into it. It's very obvious.
Thank you. And you're absolutely right. You don't go into this path, or at least most people don't go down this path unless you truly deeply believe in it, and everyone I met in school had their own story. and it brought them, it called them from where they were in their life to make a huge shift. And that was a hard shift for a lot of people to make, because there's a lot of uncertainty in that path. But when it has such a profoundly deep impact in your own life, and you see what it can do for yourself and others, it does become a passion and a calling. And you're absolutely right. And it is like so important to me. And I love learning about it, and I love sharing it with other people and seeing other people get better and become the best version of themselves.
Yeah. Well, I can tell that it's pretty obvious, and that's why I was called to. I mean, I got to talk to this guy as soon as I saw your website.
Thank you so much.
Is there an equivalent concept to leaky gut in Chinese medicine?
Great question. Yeah, it's called spleen qi deficiency. That's exactly what it is, actually. So again, that spleen energy, and really it's a spleen pancreas energy, because the pancreas obviously has a lot more to do with digestion than the spleen. But yeah, we would call it spleen qi deficiency. And that's extremely common, and that's something that we work on all the time. So a big part of that is going to be herbs, acupuncture, and then digestive and lifestyle changes. Removing cold raw foods from the diet is going to benefit spleen qi energy, because that cold raw food, it dampens the fire of digestion.
And so people don't get confused. When you say spleen energy, it doesn't mean that the spleen is defective, right?
Precisely. That's a really good point to make, because I talk with patients a lot about liver, heart, lung, and then they're like, oh my God, I need to go to the doctor and see what's wrong with my liver. And I'm like, no, it's not your liver. It's the liver energy. So it's actually in the actual Chinese language, they're not called liver, it's not the liver channel, it's not the lung channel, it's not the heart channel. They have different names, but because those energies pass through those organs, the English translation, we went with liver channel, heart channel. But the liver, these channels run throughout the entire body. So it's top to bottom in most cases. So you're exactly right. It's not something's wrong with your spleen, something's wrong with your liver, not that at all.
So for example, in functional medicine, the way we think is there is a dysbiosis. Somebody took antibiotics and destroyed their gut bacteria, and then bad bacteria grew, and maybe parasites, maybe viruses or fungus. They start, and that added to the usual truth in this part of the world, and in many parts of the world, that we are not, first of all, not eating nutrient dense foods, and then also not absorbing them, right? So for that epithelium in the the endothelium in the gut to regenerate, it needs certain nutrients, and then the bacteria are not doing their, the good bacteria are not there, so that starts causing the disruption of the intestinal lining, and that is also the way you treat, right? You get rid of the bad bacteria. You re-inoculate the good bacteria. You give them nutrients like especially like glutamine and marshmallow root and licorice and these things that promote probably the spleen energy. But the way I look at it is, yeah, you creating the conditions and supporting nutritionally the processes that will end up allowing the body, which is always trying to repair, to actually repair.
Exactly. And a lot of the herbs that we're using, they came up with these formulas literally thousands of years ago, before we knew, had microscopes and looked at the phytocomponents of every plant. But they spoke of them in more metaphoric things, like this herb drains dampness, this herb clears heat, this herb, transforms phlegm. But if you look at these same herbs now through a Western lens, through a scientific lens, and you look at the components, the same herbs that we're using for like you're talking about parasite overgrowth, the same herbs we're using to build that spleen energy are anti-parasitic, or antibacterial, and they're killing off the dysbiosis in the gut. Or licorice root is one of the classic, Chinese herbs we use in almost every formula. That's very soothing to the digestive tract. So all of these components, now that we're in, in a modern science era, we can look at the actual phytochemical compositions and see why they're working. But, they knew this thousands of years ago. They just used different terminology.
Yeah. Thousands, hundreds of years ago, they used to say that garlic fended off the vampire, right? But now we know that
Yeah.
that it's virucidal and bactericidal, and
The
um,
Alice. Yeah, exactly.
yeah. Wow, so cool. I've been always fascinated with Chinese medicine. I used to work with Dr. Frank Lipman in New York, and he's more of an acupuncturist, but he does understand about and use Chinese herbs. And at the time, this was years ago, he taught me a little bit, but I was busy. I couldn't really retain everything. But I'm always promising myself I'm going to study a little more.
It's a lot of information, it's a really beautiful, simple, complex system. And herbs especially are, in China, they're separate people, acupuncturists and herbalists. And the herbalist is a little higher on the totem pole, So here in America, we do both. I'm an acupuncturist and an herbalist, but herbs are my passion. I love acupuncture, but I love herbs even more because I think the potential to heal with herbs is limitless. It's just, do you have the knowledge? Are you a good enough herbalist to figure out the disharmony and then pair the right herbs and formulas for that person? And when you fit the round peg in the round hole with that, it's amazing what happens. People come for the smallest thing, and you're not treating the symptom, you're treating the person. So whatever the imbalance is, you put together a formula to treat that imbalance, and then as a result, the system comes into homeostasis. And then that one thing they came for, of course, gets better, but 5 or 10 other things do too. And I get messages all the time like, hey, this random thing, like this toe fungus I've had for 10 years went away, even though I came to you for something completely different. It's like, it's always some random thing that they didn't even think about. And
Well, because everything is connected. So I see that all the time.
Yeah.
That's why these days everybody's talking about the immune system, right? And what do we do for the immune system? And I say, it doesn't really matter if you're thinking that you're doing just for the immune system. If you do something that you think is just for the gut, or if you do something that you think is just for the, whatever it is, everything is connected. If you do something for the detoxification system, there is no way of affecting any bodily system without completely affecting the others. Some more immediately and some, more distantly.
Exactly. And, we all grow up in this kind of Western mindset where we're taught everything is segmented. There's a different doctor for every part of the body, and they don't really communicate with each other. And we just, go from one stop to the next. And as you well know, Eastern medicine and functional medicine too see everything as interconnected. You can't affect one system without affecting another. And
What I always say when people ask me what is functional medicine, I tell them, listen, functional medicine is if they grab your regular allopathic Western modern medicine doctor and you teach him how to think like a Chinese medicine doctor or an Ayurvedic medicine doctor, that's a functional medicine doctor.
That's a perfect description, and that's how I became really fascinated by functional medicine. Was I saw in functional medicine what I saw in Eastern medicine, finding the root, the holistic approach, and that's a perfect way of putting it.
And are you familiar with any of the Ayurvedic herbs? I'm sure there's a crossover. Like, for example, do you use something or do you use ashwagandha or something similar?
Yeah. So ashwagandha, of course, I love ashwagandha. I use it personally. I've given it to patients. It's a great adaptogenic herb, and I would say it's equivalent in Chinese medicine would be ginseng. They're very similar adaptogenic herbs. I love ashwagandha. It just depends on what I'm trying to work on. I didn't study the Ayurvedic herbal system, so I wouldn't say I'm an Ayurvedic herbalist by any means. I do stick with the Chinese herbs, the 500 or 600 herbs that I really work with in that pharmacopoeia. But the top Ayurvedic herbs, holy basil, ashwagandha, other ones, I'm familiar with them and I love them, and they're in a lot of the functional supplements that I do use with patients.
Do you know a company called Organic India?
Yeah, I do actually. I do, yeah.
this is an incredible company that started by the command of a guru, Papaji, who
Mm,
told one of his disciples to go open a company that's going to help the world. And when he went, he didn't know what to do. This disciple, which his name is Bharat, I speak about him in my latest book. And he went out, and the guru said, open a private limited company. So he went and did the paperwork for a private limited company. And then India was opening up to the West, so he started trading with, furniture and seeds and this and that. And as he was, touring the country for resources, for places to buy, for sources of all kinds of things, he came across the fact that thousands, tens of thousands of farmers were killing themselves, committing suicide in India. And the reason why was because they became, during the green revolution, they became dependent on agrochemicals. And then as the lands started to dry and don't give us much yield, then they needed more chemicals, and they ended up in a situation that they couldn't afford the chemicals and the seeds, and they ended up mortgaging their land, and the shame of not being able to feed their family were killing themselves. So this guy Bharat started looking for farmers that had Ayurvedic herbs, and he couldn't find any good ones because they were not done in the right way. They were not stored in the right way. He couldn't get really good Ayurvedic herbs. So he went to a master of Ayurveda and asked him, where he got his herbs. And he said, well, I plant them myself. And Bharat asked him why. And Narendra, which is this legend of Ayurvedic medicine, said, because I haven't found really good ones, and I had to go to the scriptures, even in Sanskrit, because some of them are not translated, to understand why the herbs that my masters had taught me and shown me great results with were not working anymore. So, anyways, he found the reason why. He started planting themselves, and 3 years of research and development, and the help of this guy, and Organic India today has thousands and thousands of acres of land of different farmers from all over India, who they provide seeds, that know how to plant and water and harvest and prepare and then they package the herbs and they sell them all over the world. So I became friends with this guy through through life, and we ended up working together. He asked me if I could help him develop a detox program for India. So I had to go and study some of the Ayurvedic herbs, and I went and studied with this guy Narendra, who after I studied with him died, and I got a very limited but incredible respect for Ayurvedic herbs.
yeah.
Um, and I would love to send you some so that you can try
Yeah.
yourself, try with your friends, and maybe expand from 600 to 604 or 5.
I would love that. I would truly love that. Absolutely. Please. And you're so right. Like the quality of herbs is paramount, they have to be really well grown and they have to be cultivated in the right way. And there are so many herbs on the market, and a lot of them aren't good, and it gives the herbs a bad reputation. So you have to know your sourcing, really working with somebody who's a licensed herbalist and knows that they're using the right herbs and the right dosing. And I love that herbs are becoming so mainstream, because it's like an awakening and people are integrating these ancient medicines into this modern life, and that's beautiful. But I think there's also a dilution, and an oversaturation, and I don't always know the quality of the herbs in the marketplace. When you go to a coffee shop or whatever, and they've got this long list of all these herbs, and they're like saying they have cordyceps in their coffee, and I'm like,
The thing is that what people have to understand is that herbs, yes, they give you fiber, yes, they give you nutrients, yes, they give you phytonutrients, they give you antioxidants, whatever. But the real work is done through prana, through their energetic vibration, through resonance, right? And I don't know if you have this concept, but I always tell my patients that I have patients from all over the world that are taking all kinds of that medications, right? So recently, I met a patient who's taking 2 medications for high blood pressure, 2 medications for diabetes, 1 medication for uric acid, and these are the big guns medications, right? And then he met this Ayurvedic doctor, and that the Ayurvedic doctor added Ayurvedic medicine and herbs for high blood pressure. And I said, whoa, 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 wait a minute, because Ayurvedic herbs act through prana and through subtle energies.
Yeah.
First, we have to change your lifestyle, reduce your medication, your Western medications, and then give herbs a chance. And I'm not sure, because maybe you give your patients that are on medications herbs and they work exactly the same, but it is my hunch and feeling, because I don't have experience with so many people as you, but my experience is that when you give herbs, you have to give herbs. They mostly act on a body that's semi broken, not completely destroyed.
Yeah, a big thing in Chinese medicine, there's an order in which you treat, and what you always begin with, ideally, is diet, and that is really the place to begin someone's healing, no matter what you're giving them, what herbs, what medications, anything, if the diet is wrong, you're not going to get very far. You can't just continue.
You kind of supplement or herb your way out of a bad diet.
You cannot. You're absolutely right. So ideally, we start with cleaning up the diet. And that's why nutrition is so important, in what I do in Eastern medicine and functional medicine and what you do. And then the herbs come later, ideally.
I'm going to tell you that initially, when I came from Uruguay and I was doing my internship and residency in internal medicine at NYU Downtown Hospital, which is a few blocks away from Canal Street and all the Chinese invasion in Chinatown in New York. I mean, invasion in a nice way. I mean, you have all the restaurants and you have all these Chinese people, and and we used to get, not rarely, people that came with really bad reactions to Chinese herbs and medicines. And then one day we figured it out. One day we figured it out. These Chinese medicine doctors that these people were coming from, the herbs they were taking, we send them to analyze, and they had prednisone. And of course, you give somebody a powder and you mix prednisone inside, and for a while, they are going to feel good.
Yeah. So that's what I'm saying. You have to know your sourcing, and that's why working with, an herbalist is key. And just Googling, herbs and ordering them off the internet, it's unfortunately not a very safe thing to do.
Yeah. I mean, I could talk to you all day, but I'm going to ask you 2 or 3 more questions, and I'm going to let you go. One is, you mentioned at the beginning of our conversation how in Chinese history and Chinese medicine's history, there's been confrontations with pandemias, and some of them worse. Yeah. Do you know any specific one, or is it something that is a general thing that you read
Well, I was reading about, I think it was in the 16th century, not that long ago, ultimately. There was a big smallpox, epidemic, and that was pretty bad. And that's actually where vaccines were invented, in China in the 16th century. What they did is they took the dried scabs of people's smallpox, and they would scrape the scabs, and then they would take that powder from the scrapings, and using a silver tube, healthy patients would inhale the scab powder into their nostrils and inoculate themselves and they'd have like a mild fever for a few days, but then they became immune. And that's actually how the first vaccine concept really began. So, that was a bad one. Other ones I don't know, but there've been hundreds. So, some worse, some not as bad. But yeah, they've been working on epidemic herbs for thousands of years at this point.
My next question is: you do acupuncture, and And I've been exposed to different kinds of acupuncture, some of them that work miraculously. For example, Frank Lipman in New York, at his center, the 1111 Wellness Center, used to put these needles that then he hooked an electrode to and connected them to a pulsing electric pulsing machine, right? And the people would switch, but the results would be kind of magic. Do you know what I'm talking about?
Absolutely. Electroacupuncture, I use it all the time myself. It's especially good for musculoskeletal pain, things like that. So, you know, back in the day before acupuncturists had electrostimulating machines, you would have to you'd have to stimulate the needle with your finger, you know, maybe 100 times per minute. You just are turning it. And that's bringing the chi, you know, the da chi is what we call it. You're cultivating that energy, and that's how you're getting the effect. The
The,
electro,
the way he explains it, Lipman, is that also the electricity sends signals through the fascia. And you know, the fascia is such a big organ involved in so many things. We're just starting to learn about it, right? But
yeah,
that was one of the explanations he gave me for, because I would ask him questions all the time for how we could see these miraculous effects.
yeah. There's a great book called The Spark in the Machine, and it's about acupuncture, and it talks about uh, the basic premise is it's explaining how acupuncture works, and it's all via the fascia, because fascia is made from collagen, and collagen conducts electricity. So everything we're working on is an electrical impulse that's sent throughout the whole body, is connected via fascia. So when we're going in with a needle, we're going into the fascia, and we're communicating via the fascia to every part of the body, the brain, the nervous system, all of that. So that's exactly correct.
The other acupuncturist that really impressed me in life is a man called William So. He's a Korean acupuncturist. He's here in LA, in Koreatown, and he comes from a three-generation family of acupuncturists. And the reason why always is the results. He has, I mean, I've taken two friends of mine there. I've literally took them on a wheelchair,
Mm.
and then carry them upstairs because it's in a second floor, and they came out walking in the first session, right? And the way he does it is with this long needles. I literally think sometimes that the needle is going to go through, when he puts it through the back, that it's going to come through the stomach. They're so long.
Yeah,
It's just insane. And I'm asking him, because he has a drawing of the spinal cord with the vertebra, and I'm asking him, well, where does it go? And it's just insane. Have you ever seen or have you studied this type of acupuncture?
yeah, absolutely. So we studied at my school all the different forms, and you're right, there are many. There's Japanese, there's Korean, there's Chinese, there's Taiwanese, and they all use different approaches. And yeah, I have some long needles myself, 5-inch, 7-inch needles that you use in certain instances when it's appropriate. And that's, you know, a great example of how it's like magic, you know. It really, in instances like that, somebody comes in a wheelchair and leaves walking. It's magic, you know. But it's using the body's own healing resources.
My own mom is one of his patients. She came to see me literally. She had to get off the plane on a wheelchair. She could walk and stuff, but you know, when you travel, and I went to pick her up at the airport, and you know, she was crying. My doctor said I'm going to have surgery and fuse I said, let's go to Dr. So first. And we went there, and this is 3-4 years later. She's doing fine, and she had maybe 5-6 sessions with him. Of
Yeah.
course, he gave him his own recommendation of a diet, which basically is very similar to the one that I was giving her, right? And she stuck to it. There are a few differences, and maybe on another talk, because I have so many questions about what he does that maybe you can answer, because he doesn't speak English, so I cannot
Right.
I cannot really drill him in it with questions.
I know, you know, all the acupuncturists I used to go to didn't speak any English either. They just took my pulse, looked at my tongue, and needled me. So like I do feel like it's helpful that I can speak English and I can kind of communicate these things to my patients, because people are really interested, you know, to know what's happening.
Yeah, of course, and more and more.
Yeah.
More and more now, people are looking for ancient wisdom. You know. My last question is this: what's with cupping? Because I never even asked myself. I mean, there's so much to learn, right? There are things that I haven't even had time to ask a question. So that's my
Yeah. Cupping, that's an ancient tradition from all over the globe. In the Middle East, Russia, Africa, Italy. It's been used for hundreds and thousands of years all over. So it is a huge staple in Chinese medicine for sure. And it's, again, just using your body's own healing resources. So the suction of the cup creates autohemolysis, the destruction of red blood cells in your body. And then that generates new red blood cells. And those carry fresh oxygen to all the tissues, all the healing components of that. It's like a micro trauma, and it creates that bruising look, but it doesn't feel like a bruise. And it's generating white blood cells, fresh red blood cells. It's affecting the pain threshold, so it's really good for people with musculoskeletal issues. And really, it's very detoxing. It clears the old and it brings the new.
So it's similar to the concept of rasa and rejuvenation in Ayurvedic medicine.
I don't know what that is, but I'm going to say yes.
Yeah, well, rejuvenation it's
Yeah.
something that here in the West I just now first heard somebody talk about rejuvenation from a scientific, medical point of view, which is Dr. Jeffrey Bland, the father of functional medicine. He was talking about the rejuvenation of the immune system, right? How the white blood cells are produced in the bone marrow, and then they go and rest or get deployed to the intestines, most of them, right? And they come out undifferentiated, and then they differentiate in life according to what the body is needing at the time, and then they start aging, and they start accumulating, debris and proteins and all kinds of things and toxins, and they get old. And the process of rejuvenation of the immune system is having a two things intact, right? The production of new white blood cells, and then the activation of autophagia, or eating yourself. So the new the new white blood cells will come and eat the old white blood cells, right? And that's how you keep rejuvenating your immune system.
Yeah, so cupping is just tapping into that process and giving it a little nudge, and it works really great. People feel terrific after it, and it's really simple, 10-15 minutes.
Yeah, you it's like judo, right? You use that own energy to move that process forward.
Yeah, absolutely. And you're clearing a lot of stagnation. There's a lot of stagnant blood and energy that builds up, especially in the back and neck, and it's stuck. And we're helping to clear that out. And anytime you can clear a blockage, you're promoting life.
Cool. Are you isolating yourself for the time being, or are you seeing patients?
I'm doing telemedicine completely. I'm working with patients almost every day. I can do probably 75% of what I do. Can't do the acupuncture or the cupping right now, but I'm doing tons of herbs for people every day. People are really getting into that, even people who didn't want to in the past. Lots of supplement protocols and diet, lifestyle recommendations, stuff like that. Yeah.
Great. Well, I hope this passes soon so we can hang out, and I can bring you some Ayurvedic herbs.
Please, I would love that.
Yeah, great.
Yeah.
Thank you so much for talking to me today, and I look forward to hanging out in person with you.
Me too. It was such a pleasure. Thank you.
Bye.
Bye.